Happy Sunday, everybody. Welcome to our Natural Health News live show. And it is a very sunny or non-sunny Sunday morning here in Atlanta. And this morning, over coffee in our robes, I want to share with you really the big question, the big debate. Do I have coronavirus, COVID-19, or do I have cold and flu symptoms, or do I have allergies? And really kind of breaking down what the CDC, the World Health Organization, and the American College of Allergies and Asthma and Immunology have listed as symptom kind of guidelines. I think this is really important because a lot of you, like us, are dealing with springtime up in the Northern Hemisphere. And there are certain symptoms that are related to allergies and colds that are not related to the viral infection that is this global pandemic. So I really want to break that out specifically. Welcome to all of you joining on Instagram. Good morning, and same with all of you on YouTube. For any of you new joining, I'm Dr. Melissa Gallagher. I'm a naturopathic physician, and I focus on addressing the root cause of illness and disease, the use of functional medicine, natural therapies like homeopathy, and herbal therapy or botanical therapy, as well as an assortment of complementary therapies. I happen to be a lymphatic drainage therapist, and so I work with a lot of patients post-surgically and work with individuals through their cancer diagnoses, as well as individuals with lymphatic diseases like lymphedema and lipedema. And actually this month is Lymphatic Health Awareness Month, or Lymphedema Awareness Month. And so today's video, there's two parts to today's video. And the two parts follow the kind of update with the news as to where we're at. But part one, I'm going to break out the symptoms. And so I've got kind of a guideline, a little chart here of, symptoms that are common or not common, depending on cold, flu, allergies, or COVID-19. The second part, I am actually going to show you a DIY technique that we use, particularly in physical therapy and congestive related conditions that are mucus heavy or chest kind of congestion heavy. This includes bronchial challenges, airway restrictions, just dense congestion, and then also pneumonia cases. So it's called CPC therapy. I'm going to show you a DIY, a technique. So stick with me through this whole live show. I promise it'll be valuable. It'll be valuable for you and any of your loved ones. And I just want to commend each and every one of you, one, for taking time to join me today. And second of all, I want to appreciate you and give you gratitude for all your support. These shows are a labor and an act of love here at Natural Health Resources, primarily because here on YouTube, they demonetize and are really censoring a lot. It's challenging. So for all of you on YouTube, please give me a thumbs up because that totally helps support the algorithm. And then also it does support, I appeal every demonetization, like a little yellow flag. And so I've said the major words today, I'm going to get flagged, but I am referencing the CDC and the World Health Organization. So these are valid, viable, clinically, not, I wouldn't say proven because there's still so much that we don't know about the virus, but we're seeing these as clinical guidelines to diagnoses. And if any of you have been watching my lives and joining me every day, I really am grateful and appreciate it. And for many of you who've given me the live chat or the super chats, which is a donation on YouTube, I'm grateful for that. That really supports us. We also have a community, and there are more of you writing me that think you might have the virus and aren't sure what to do. You're getting a lot of different feedback from your local physicians, or having a hard time getting in a telemed appointment. So that's why I wanted to address this. I know it's a big question just kind of globally. So that's why we're going to talk about the common the comparison of symptoms versus common conditions like cold and flu and allergies. But I also know that many of you have tests outstanding, and I am Felicia Butts, one of our Instagram followers. Her husband, it has a test that's outstanding. And so these are really trying times, and I really wanted to try and equip you with resources and information to help you make healthy decisions for you and your family so that you stay the safest and the healthiest through this period of time. And we're in it for the long haul, but we're in it together. So that's what I want to kind of communicate to all of you. So first, I want to say good morning to everybody. I see Nicole, our lovely wedding planner, is on. Hey, Nicole, I tagged you on something. They had a news article I saw on Instagram TV about the wedding industry. It's so crazy. So many industries are being impacted by the situation. Hi, Kathy. Good morning. And Kim and Wendy. Hi, everybody. And I see long-legged Lithuanian. She sends me such great videos. I appreciate it. All right. So we've got Cupcake Paper and Emma Gem, Kay Jefferson, Pat. Good morning. Oh, by the way, I'm excited, Pat. Yesterday, when we got our mail, we had a letter in the mail, our first letter that's going to go back on our little shelf here. So thank you to Pat. She was inspired. This card was inspired by the crazy squirrel that steals seed from the little bird feeder outside. So this is super cute. And she put in, I don't know if you know this, but I'm a crazy cat lover. She put in this cute little seal. Gabriel and I had such a great time opening this up. She put on a cute little stamp. He adored the stamp. Love the kitty cats on the front and back. So thank you. And the little note, I have the same paper. I thought that was so funny. So I'm so grateful, Pat. For all of you, we're welcoming letters. And so Instagram, you might not be able to see. I'm going to spin the Instagram camera. That shelf, I'm going to be adding cards. And so DM me if you want our address. Gabriel and I are, it's another activity where we're staying connected and connecting with people. And he's like, Mommy doesn't have any friends. He thinks you guys aren't my friends. It's just kind of funny. But he likes to now play in my office. He likes to play director. So he likes to try and set up all my lights, and he likes to take the microphone. It's kind of funny. So it's part of our fun adventures of homeschooling and connecting with people. And one of the things we're doing is, as we receive your letters, and they don't feel like you have to go all out just to send us a letter. I'm going to chart for him where they're coming from. So we go over states and cities. So it's part of my kind of homeschool lesson plans that we're having. That's fun. So anyway, so that a little side note. Thank you, Pat. I am grateful. So cute. He loved the seal. He wanted to pull it off. So welcome all of you joining, and on the replay, at least on YouTube, the replay is live or it's housed on YouTube forever. On Instagram, it shows up on my Instagram stories. There's an option you can see my stagnant stories or like my live feeds. That's only up for about 24 hours. So for Instagram, if you feel like you want to see this on the replay, you can watch this for all the time over on YouTube. And Nicole, you're welcome. Hi, I am Felicia Butts. Gabriel is super fun. I got him probably the best way. This is a little side note for all of you. I've been doing orders on like Michaels.com and Joann's. Those are places we usually go to for like holiday crafting and stuff. I went to Target.com and they had, I don't know, I think they're still, no, they ran a 25% off coupon deal online for a toy. And so I ended up getting him this soccer net with a soccer ball. Oh my gosh, it kept him busy for hours yesterday. And it's great because one of his after school activities has been soccer. And so that was a great find. And I'm so grateful. So I'm telling you that because we're just trying to, probably like all of you, trying to survive this and keep particularly our little ones occupied, busy, and really trying to make it fun. And so that's where the letters come into play. Like Pat sent us this letter. So this letter will be going on that back shelf. And he had such a fun time. So if you do send us a letter, it's all for Gabriel. I appreciate your letters. He just thought it was so exciting. When you're little and you're getting a card and opening up a card, it's so fun. So thank you again. And M's Gem says, I open mine with gloves. So yeah, so I actually spray it down and he has gardening gloves that I give him now because he does want to be more engaging with things. And he has gotten, like for St. Patrick's Day, he got some note card or notes and letters from friends. And usually they send him like $2 or $3. And I tell you what, $2 or $3 for a kid, you would think he hit like gold. It's so sweet. Okay. So, but yeah, you definitely want to make sure you sanitize and take all the appropriate cleaning measures, which I have covered in another video. So you can grab that. But let's talk about the news, and then we'll go into the two parts of today's video. For all of you joining, the two parts, I'm going to talk about how do you know symptom-wise what category do you fall in? And this is very much driven by CDC and World Health Organization guidelines. And then the American College of Allergy, Asthma, and Immunology, they actually have symptoms kind of broken down. If you have the cold, what are common symptoms or atypical symptoms, flu, and then allergies, and then COVID-19. So I want to really give you those resources. And then the second part, I'm going to give you a DIY chest congestion technique. It's a CPC. It's a therapeutic physical therapy type of activity you can employ on yourself and your loved ones if they start to get congestion or maybe are recovering in quarantine at home with pneumonia. So this is a very common infection with this virus. So this will be a good tool. Okay, so I have just a little bit of news. I think we're just going up on the incline. We continue to be in the #1 spot. We're at almost 125,000 cases. We, in 3 days, our mortality numbers have doubled. So in 3 days, we went from 1,000 deaths. We're now at 2,100. That's pretty substantial. That again matches the exponential growth that we see. 25% of the fatalities are in New York, and New York they've topped 50,000 now. They're at just above 51,000 cases. New Jersey's really made a big jump. New Jersey earlier, like 2 or 3 days ago, they were in the 3,000-4,000 mark. Now they're at 11,000. And part of our challenge is we don't have enough data. We don't have enough testing. I mentioned yesterday the FDA has approved a 15-minute test. The question is accurate is another question, but we need to know who has the infection, even if they're asymptomatic, and then we have to kind of follow suit, like the people in your network, and kind of branch out to help offset some of the extent of this, but also to be strategic with our healthcare material needs, the PPE, the personal protective equipment, as well as kind of identify where is that peak and how, what's the difference between matching the healthcare capacity to handle that. So I've looked at a few other states. Washington and California are hovering in the mid 4,000s. Florida is moving up pretty quickly. They're in the 4,000 range and not taking really any significant stay-at-home measures. Some areas Florida is such a huge state, but they have not gone in the aggressive form that California has. And I think that's why we're seeing them move up so quickly. Georgia's at 2,400, Illinois is at 34, almost 35. Michigan's past 4,600. And Michigan is having some challenges actually getting equipment and materials. Apparently, there's reports that the administration, because she's not agreeing apparently with some communication with the president, that they're not going to be, they're not getting supplies sent. That's insane to me. I really hope that's not true. But who knows? Sounds like petty craziness at the risk of lives. So here's some news. Amazon and Walmart are ramping up their staffing of the grocery deliveries. So I don't know how many of you who, like us, we've moved to doing Instacart and Shipped, which, by the way, when I did my Target.com order, I had to bifurcate my orders. Some were shipping orders, and I got Easter items for little man. And then we also had some things like Brian really likes. He tends to shop a lot at Target. So I just kind of stocked up on these like fruit bars he likes. And then he's totally hooked on these Starbucks iced coffees. I wish he would let me make them. But anyway, they bifurcated. And even though I haven't registered for shipped, they just put some of the items, I think it's like, you have to have a $35 order, shipped, delivered the same day. I couldn't believe it. I couldn't get an Instacart to deliver Target. It was a 5-day, kind of window of delivery time. So I think that's kind of interesting. And I see cupcake paper. She says, I did Instacart yesterday. It cost $11 plus $4 delivery added. Yeah. And we're really generous. I think we, one of the things they're shopping for us, and we tip them. And then I even put cash in an envelope on the door, just because I don't know how quickly they get those tips in their payment process. So, all right. So, I know I'm going to say this. Shedex to you, stayed home 18 days now, loving the time with family. That's awesome. J King 2023, my Kroger has delays of 6 days for pickup. Yeah, that's what we're definitely seeing. But I will tell you, I'm kind of calculating like where can I get certain things, and some of the things I've had to switch just going through Amazon. Although you have to be aware, I've noticed some people are doing some price gouging. Some of these I'm going to say tool bags, but these people are, they seem to be buying stuff and then putting like a bag of, like gluten-free. I was looking for oats. We're not out of oats, but if I keep baking at home, I use oats a lot. Somebody had a bag. It was like $20 for like 12 ounces. It was so crazy, but apparently you can tell your state authorities. And Dale, welcome Dale. Hi Lois. Yay. We've got some of our YouTube members on. So grateful for all of you. Okay. So we're going to dig into the 2 tips that I'm recommending, or 2 things that we're talking about today. YouTube, please give me a thumbs up. We have over 100 on, and I'd love to see my little thumbs up at 50 or 60. So, and same to you all, and hit the share button. Thanks everybody. Okay. So, onward with some news. Okay. I forgot this. South Africa. I think it was Johannesburg. Everybody around the world is dealing with this. And so I think the military, apparently people are not taking the social distancing precautions when they were out in a shopping setting. And apparently the military shot rubber bullets at these people. So, some governments are really taking this seriously. Like, that's not funny. It's just kind of crazy that they would do that to these poor people, as if they're not stressed enough trying to get supplies to feed your family. One major important article that I read yesterday, and I think it goes along with this that I read yesterday from the Henry Ford medical system up in Michigan. This was the first life and death hospital-based policy that we're seeing, that basically, if you didn't join yesterday, let me give you a quick little overview. Basically, the hospital sends out to our patients, to families and community. It said, basically, patients who have the best chance of getting better are first priority. And they gave 4 points into what does this mean? Patients are ultimately going to be evaluated in terms of the best care plan, and that they, if you are a DNR, that they want to know that right up front. The other thing is they said, if you are in the extremely sick category and unlikely to survive, that they would treat those patients in a different way. So basically it said treating these patients would take away resources for patients who might survive. So it's put us into a whole new kind of category where patients have to meet eligibility. So it basically said, if your medical doctor believes that you need extra care in an ICU or a ventilator, you need a breathing machine, you will be assessed for eligibility based on your specific condition. So they're going to go case by case, obviously using labs. I talked a lot about yesterday to try and, really support your body so that you have better labs in terms of your inflammatory markers, C-reactive protein and ANA levels. Like those are all going to be evaluated in this. But they then said patients who are not eligible will receive treatment for pain control and comfort measures. And if you're in the dying category, just consider that like a hospice type of care with morphine. And they did list on this, they listed 3 categories of that might make you ineligible. That would be anybody with severe heart, lung, kidney, or liver failure. So if you're in the ICU, pre-ventilator, or even checking into ER, and you're already starting to see, you have heart disease and it's triggered congestive heart failure, or any of these other conditions, that might put you ineligible. Okay, so that was really big. That memo went out, I believe Thursday or Friday. I think it was Friday. And so I reported it yesterday. Now there are at minimum 5 hospitals and healthcare systems who are considering something called universal DNR, which means they are going to, their plan is, even if you had even if you go in and you didn't have a DNR, so like I personally don't have one, so I want to be resuscitated. If I went into that setting, they would supersede my desires, and they universally, it hasn't been completely put out in policy like that. But what these hospitals are considering is the amount of time equipping themselves with PPE, the break of the negative pressure in the room. The negative pressure actually is supposedly minimizing the viral respiratory particles. That's apparently a really big problem. And one of the reasons why I think we're probably seeing higher transmission rates with the healthcare systems, because they don't even have the hair nets and stuff. And when they're in a room working on somebody, they might have the goggles and the mask, but if their hair is not protected, they walk out, they touch their hair, 3-4 hours later, or sooner than that, there could be transmission. So what's happening is we're seeing hospitals anticipating they're going to meet this kind of high level, and they're putting in, they're having discussions about maybe considering universal DNR. So let me tell you, if these hospitals are in your area, some are here in Atlanta. So I will tell you, some are really big systems. The biggest system on here is Kaiser Permanente. It's mostly in California, out west. We have they have some satellites throughout the U.S. Let's see, GW, so George Washington Hospital is associated with the university. They're considering this. Northwest Memorial in Chicago, Atrium Health, this is in the Carolinas, and then I think it's Geisinger in the Philadelphia area. So that's important to note. If those are any hospitals that might be servicing you, your friends, your family, I think it's important for us to know. Okay, so I put that out there. I'm trying not to depress you, but it is what unfortunately the healthcare system is dealing with, because they're anticipating that, I showed yesterday, I was trying to see if I have it over here. I don't. I showed every state will be reaching max capacity. So Kathy from Texas said, very dangerous ground. I totally understand. It is really, really crazy. Okay, so Dale said Ford Hospital is where I almost died in 1969. I'm sorry to hear that. Cupcake Paper said, how can they legally do that to people? So, we are in uncharted territories in the healthcare world where ethics, there's so much at play here. There is capacity, there is equipment, there is manpower, staffing. I think it's 25% of the healthcare providers and frontliners, they're testing positive with the virus. So it's just a matter of time. They're all exposed. It's a matter of time them catching it. So that puts us in a situation where hospitals, unfortunately, are having to make these choices. And doctors, a lot of individuals in healthcare, we take an oath to do no harm. It is doing harm, but it's one of these things where like there was in the article, and I'll post it. It was it was in the Washington Post. The article interviewed several doctors, and they were literally like, we would code somebody who's already flatlined or has gone beyond the limit, because they said it takes so much time to put on the equipment. And I mean, those are things like we don't think about. And I didn't really mention that yesterday. Like there's the initial like horror of the situation, and just I have such empathy for these healthcare providers. They're not equipped to be doing that. And and I used to work in healthcare staffing. They're going to look at the bottom line, and they're going to be looking at the dollar values of everything. And then how can they manage just this influx? It's going to be something really crazy. Okay, so Raquel said, I read somewhere that someone died of corona because they were denied in hospital because of no insurance. Yes, that was actually, I think, a 20-something-year-old. Supercalifragilisticexpialidocious. My husband works in the front line of ER. They were sending medical staff home because they were sick. Yeah. And that's why we see, like up in Massachusetts, where it's now over 160 healthcare providers have the virus. The whole entire state released the fourth-year medical students to come in, and that's a challenge. Lori, I live in New York State. The New York people started coming up to their second homes. We went from 1 case to 65 cases in a matter of days. Yeah, that's actually, I think, one of the reasons why Florida is telling New Yorkers and New Jersey, folks in those areas to not come down. Like there's a travel ban. I think that's been in place for over a week in Florida. and we've had somebody on, this is not just in New York, but somebody was out west, and mountainous areas, people kind of escape to their second homes because they're like, oh, I want to exclude, I'm acres away from people and I could just hunker down in my house. And the cities have seen a spike. And that's the one thing right now, they are showing poor rural communities have no cases of this. So this is a case or situation of, densely populated communities, airport access and travel. And so it definitely is a challenge. And Mardi Gras, Dale brings up a really good case. So Mardi Gras is, they're seeing Mardi Gras is kind of some of the statements they were basically AIDS. They were throwing the virus. And that's one of the reasons why they're attributing New Orleans, Paris to being the epicenter in the South. And they have an 8 to 9, their mortality ratio is 8 to 10 times more than any other state. And I think that is global with the, in the global state of it. So it's really challenging. Okay. So let's dig into symptoms. So, right now, yesterday, we were outside a lot. My car is absolutely yellow. Pollen is everywhere. Everything's blooming. It's springtime. And some of the symptoms that accompany allergies could maybe make you think, okay, maybe I have the virus. So I want to break down allergies first, because that plagues many of us. And that's one of the reasons why I'm wearing my glasses. We were out a lot, and my contacts, I just felt a little bit inflamed. So in allergies, sometimes people have fevers, but for the most part not. They sometimes have dry cough, like if you've got some postnasal drainage because the allergens are irritating your sinus passages, dry cough can be common. Shortness of breath with allergies for folks who are asthmatic or have COPD or any type of respiratory grief or weakness with the respiratory system, they can have shortness of breath. That is that is common. So that puts this in terms of the category, shortness of breath is a very common symptom with COVID. Headaches. Well, sometimes you have a sinus headache. So you could categorize yourself as sometimes having a headache. There are no aches and pains that go with allergies, very unlike COVID. Sore throat doesn't accompany allergies. So a lot of times you can start to go, okay, aches and pains, totally fine, you're mobile. There might be a little fatigue because your immune system is addressing the foreign invader of pollen. But generally, it's sometimes. Will you have any digestive grief like diarrhea or nausea? No, you won't have that with allergies. And that's a big, big difference. Runny nose can be common with the allergies, not common with COVID. So if your nose is running, that is not, and actually, it's not even not common, it's rare. So rarity with COVID is it's rare to have a runny nose, but very common if you have allergies. And sneezing, totally common. You know, that's the way the body's trying to expel pollen out of your nose, and it's just part of the immune response. That is not at all a symptom. So sneezing is not a COVID symptom. Okay, so is that helpful? Anybody out there experiencing allergies like I am? And I can't tell if it's going to rain today, but our plan was to do a Home Depot delivery order today, and I was going to start turning my garden beds, and we're going to start our starter seeds today. Okay, so Dale says, no kidding, every time I sneeze or cough, my head plays tricks on me. So yeah, so if you're sneezing, the COVID, that is not a symptom. Okay, so seeing CDC said kids have runny noses. Yeah, this actually I just pulled for adults. Kids respond very differently. And, you know, sadly, I didn't report this, but Chicago had their first infant, not an infant, but a death of a baby. So a child under the age of 1. Apparently they had some juvenile related diseases. It didn't list what it was. Rave stitches, my ears are plugged with allergies. Yes, in fact, most popular, like my 1 million+ viewed videos are all about how to drain the ears. And I think I have 6 of them now. DIY, I show you lymphatic draining techniques. I also share with you like things you can do kind of to move and open up the eustachian tube. So any of you dealing with the ear, like here up in Georgia, when I moved, that is how I experience allergies. It's kind of puffiness, eyes, like my eyes water a lot. And then my ears pop all the time. And I actually had the first season experience here. I had fluid in my ears, and that actually prompted that video series. And it's been the most popular videos ever. Like, that's great. Okay, so you do my videos all the time. Yay! Do you experience an impact? And everybody kind of has a little bit of a different not mechanical, but a structure of the ear. So some techniques work better on other people. Like I have some people who have smaller ear canals on one side. And so that's one of the things that it can be helpful. Oak count is really high. K. Jefferson. Okay, so, Veruca Short. I hope many people 19. That's not a positive wish. Okay, so YouTube seems to be kind of in stall mode. Hi from coming the other day. My horror when in the grocery store, a man coughed a lot. It was in DeKalb where rates are high. I cringed and prayed and took immune support ASAP. Yeah, it is. Gosh, Georgia's really, some of the rain I thought would help, but shine after the rain. Oh, I have a tree that literally is just yellow. Okay, so yeah, I'm going to go ahead and block Veruca. Okay. Hide user. I'm just going to report that because I feel like that. Sorry, you guys on Instagram. We've got somebody wishing people get COVID. It's crazy. So very common. We get lots of trolls sometimes, depending on how popular the video is. So I feel like I take that as a good sign, right? Okay, so if I plug my nose and blow out, yes, that's great. Okay, so those were the allergies. Okay, so very common right now for a lot of folks we're dealing with Flu. Let's dig into the flu because flu A and B are high. We're in flu, peak flu season. Okay, so the flu, it's common to have a fever, and that's very similar to COVID. It's common to have dry cough. That's very similar to COVID. You do not have shortness of breath with the flu. So a big factor is shortness of breath. Headaches, it's common with the flu to have a headache, but sometimes folks with COVID have a headache. So there's a little variance. Headaches are more common with cold and flu. Cold and flu, common to have aches and pains. When I have had the flu, that is like the first thing that I experience. And I think people experience different immune reactions. So some people have the headache first. Some people have, the coughing or fatigue. And I think the other element we have to factor into some of these symptoms is how your unique individual body responds, your own immune system. And we all have a different immune system and immune response. But flu is very common to have aches and pains, very common. Sometimes COVID cases have a sore throat. So there's that other variable. It's more common in the cold or in the flu. Fatigue, extremely common with the flu. That's the only time that I find that I can just sleep throughout the whole entire day and not be motivated. COVID, it's sometimes, but the thing that I've been reading as we've looked at more individuals having their situation or describing the impact, there's a point where they just get hit hard with fatigue. And so it's not like they always are able to work through it. Sometimes it takes them where they're bed bound. And it reminds me of when I had Epstein-Barr in my 20s, like how people describe that. With the flu, sometimes there might be diarrhea, and digestively, there may be diarrhea, but more so, the nausea is a factor with COVID. So sometimes there's a little tummy upset or diarrhea. It tends to be less common in COVID. Flu, sometimes you'll have a runny nose. It's rare with COVID. Okay. And then the flu, you don't sneeze with COVID. Okay. Now, let's go into the common cold. And this is something where some people are like, I'm always experiencing cold, like, a cold symptom. And sometimes it's where you have to look at the allergy versus cold. But the cold, 101, like there's such an immune hit. That's where we see the response of the fever. Dry cough is very mild in the cold, where it's common with COVID. Common cold, you don't have shortness of breath. It doesn't have that type of respiratory impact. But again, it's common with COVID. Headaches, generally, it's rare to have a headache with the common cold. But again, COVID, you'll sometimes experience a headache. Sorry, you guys, it's buffering for some reason. I don't know why. And maybe I have noticed a lot of people that I watch and follow, they're all going morning. So that might be one of the reasons why we're buffering. But okay, so headaches are rare in the common cold, but can be sometimes a symptom of COVID. Common cold might have aches and pains. It can be common for that, sometimes with COVID. Sore throat is common with the common cold. Sometimes you'll have a sore throat with COVID. Fatigue, sometimes you have fatigue with your common cold, and sometimes you have fatigue with COVID. You won't have any digestive upset with a cold. You might have a digestive upset. Most of the digestive upset that people are experiencing, and I talked about this about a week ago, where we were seeing 48% of the cases that were in the extreme acute status where they ended up getting the ventilation. Those individuals, they had a digestive impact, but most of it was nausea. So they'd have nausea, sometimes vomiting, diarrhea a little bit, but it was very select. So, and it was accompanied by the 101 fever. So that fever point is really the point. Like if it's not a bad idea to be taking your fever if you feel like you're a little run down. That way, and start to assess. I don't know why we haven't seen companies and grocery stores starting to evaluate people's fevers. I think that is the smartest thing that other countries have done in terms of keeping people safe. And if somebody's at 101 or getting close to it, there should be a fever marker that you're not allowed in, because the likelihood of you having even some other contagious illness like the flu, it keeps us safer. But we haven't implemented those measures yet here. And I say yet because usually we see this progression. So we might see more of that here. Okay. All right. So the other thing that is sometimes will accompany, sometimes you'll have fatigue with the common cold. Sometimes you have that with COVID, the diarrhea. It's common to have a runny nose. So in a cold situation, your nose will run. You're going to be running through, sinus or the Kleenex boxes all the time. That is really rare with COVID. And, I think that was the other thing. I saw a lot of people grabbing all those Kleenex boxes, along with toilet paper and stuff. That's not a commodity need to address the COVID. Sneezing is common with a cold. So if you're sneezing a lot, like the individual incoming at the grocery store was sneezing, he probably had the cold. And we don't see sneezing with COVID. Okay. All right. Let's see. So Kathy, on a journey, definitely check your temp. If it's up, check hourly. That's a great idea. Gaffney, Mel, Shiori. Yeah, I don't know what's wrong with people. People are crazy. The spammers, the trollers are really annoying. Okay, so I have stuffy nose and congestion. Other than that, I feel fine. Let's see. Tani B, if you had CV in the past and test now, do you always show up as a positive? That's a good question. Now we're seeing it depends on the efficacy and the accuracy of the test. But generally people test positive, and then the way we kind of know that you're doing okay. And on the other side, at least in other countries, you'd have to pass 2 negative tests to know that you are not contagious. But they had a case in Wuhan. This was reported Friday. They had a case in Wuhan who had been ventilated, tested negative, went home, came back with symptoms and tested positive. So I don't know what that means. I know they're doing analysis on that individual's body. We don't have antibody testing either, which will be something that we will see. Probably more antibody testing, being able to help identify, who's had it. Like the other thing, I've talked to 2 people who are like, I think I had, the virus in January. The likelihood of that maybe, but honestly, probably not. But that's the challenge is, oh, it's raining. That's a challenge when we don't always know what these symptoms are. And I want to tell you guys, I'm working on with my web developer. He's in India. So he's in lockdown, like California, New Jersey, and New York. He's with his family. So he's helping me. We are putting together a page, a COVID-19 educational page, and we'll be housing all of our live shows. And then I've got all these blog articles coming out. I will be posting this. So I'll grab this and I'll post and link to this so that I'm hoping he works really fast. So we'll probably by Tuesday, maybe even tomorrow, kind of depends on what I can get to him today. But we'll have an active web page that's housed on our website that'll have info. And we are even bringing in the active live map, the interactive map. So that's huge. Okay, so Rita Rack 77. I can't find a thermometer. Go online. Actually, go online. There's a company. Let me go back. This is really kind of interesting. I reported before that there's a company that makes digital thermometers, and the digital thermometers, this company's using the digital thermometers to evaluate the 101 plus fevers, and where they chart it and track it. So they can kind of get a sense of where things are heightening. And they were able to identify certain states and certain areas that ended up being epicenters. Let me get the name of this one company. So let's see. I'm trying to find what's the name of it. I can't find it on here, but there's this one particular company that they've got these digital the digital thermometers. And this is like my war book. So these are my show notes. This is just for all of you. And every day, like I hear something new, or I read a new article or new clinical research, I put it on my list. So that is really kind of interesting. So if you don't have a thermometer, you get one, because that's really the only way to measure. You can grab them online. I know Walgreens is now doing delivery services, and you can drive through your Walgreens and you can get items at the drive-through. So that's a really good distancing measure, which is really great because they also will grab you cold medicine or symptom relievers. And that's, I've received the national email. So they're doing this nationally. But do equip yourselves. All of you should have a functioning, working, good battery. Is to replace your batteries, and some of them take, unique batteries, but make sure you've got your thermometers, because that really is going to be the powerful way of measuring the fever. So let's go into COVID-19 symptoms. Okay. Fever is common. Dry cough is common. Shortness of breath is common. And that's a marked symptom. That's when they say that's when you should be calling your doctor, calling the ER. It's a shortness of breath, or if you're coughing up blood. Okay, so the way the virus attacks the body is it attacks the lung tissue, and it can turn into pneumonia very quickly. And the coughing up blood is an indicator that the virus has gotten into the lung cells. It actually changes the cellular makeup of the lungs. We see CT scans of the lungs. I don't even know if we have that capacity here in the US if we're doing it, but like South Korea, in their measuring and monitoring process, they were putting people through CT scans. They had portable scanners. They could scan 200 people in a day. I just don't know if we have that ability. Okay. Shortness of breath. So that, again, the coughing up blood, that's huge. Headaches. Sometimes you'll have a headache. Sometimes you'll have aches and pains. Sometimes you'll have a sore throat. Sometimes you'll have fatigue. Some people feel, said on the milder side, it just felt like your normal flu. But others have said it really hit me hard. And again, that is the variable. The immune system is different. Emerald style. Yeah. So I have, I can't turn closed captioning on the live feed. They don't allow me that capacity. So I had a question from somebody about closed captioning. But I do when it's all wrapped up. So in the editing, I have the capacity, but I just don't have that function through what they call YouTube Studio, which is the setup that I do my live show. It doesn't let me do that. I promise. But I will message them to make sure. Okay. So fatigue sometimes, diarrhea is rare, but there will be, in the severe cases, often some degree of digestive grief. Not always. Nausea, particularly. So one of the things that they found, nausea was a big factor for individuals. It is rare to have a runny nose, and you will not. There's no sneezing. So if you're sneezing, odds are you might have the cold, or you might have allergies. So totally common. All right. So The amazing Eddie Haskell. Okay, not sure. Let's see. Gosh, lots of folks. I'm gonna just delete him. Report. Okay. So, all right. We don't tolerate violence. Talk of violence, sexual conversations, or pornographic language, or racism. So just a little FYI, people who might want to go trolling on my channel. We don't tolerate that. Okay. So those are the symptoms, the breakdown between common cold, flu, allergies, and then this novel virus. Any questions you guys have, let me know about them. And, you know, the big thing that they say is kind of they call it the trifecta. It's dry cough, the fever, that's 101 plus, and some people get into 103. It just kind of depends again on the immune system. But then the shortness of breath. So if you are having a hard time breathing, because it is a respiratory, it puts people into, you know, severe acute respiratory challenges. So there's an actual label for that particular part of the disease. That definitely does require attention and action. And so if you do experience that or know of anybody, make sure they don't delay and get addressed. Okay, so now I'm going to scoot back a little bit because this is part 2. So hang in there with me. On Instagram, we have about 7 or 8 minutes before I have to start another one, but YouTube, we're still going. And for all of you YouTubers who like this, please give me a thumbs up. Let me know that this is valuable content. Kim says, you never know with the virus. It seems people who think they're really healthy are getting really sick. How do we know if our immune system is good or not? You know, the challenge is that when it's put to the test, but also just good, healthy habits and, you know, sleeping well, getting your good nutrition. Everybody's body's biochemistry is different. And then also our gut health is a big part of our immune response. One of the things that I want to caution, we always hear, I've heard reports, oh, he was really healthy. He was only 38, but he was really healthy. Well, you can be 38 and you can have underlying conditions that you didn't even know about. And there are a lot of people walking around with pre-diabetes, and diabetics are in a risk category. It affects the kidney. There are people who've recovered that have to be on kidney dialysis because the lack of oxygen from the respiratory condition put strain and damage their kidneys. So people can be walking around totally, you know, we look at them, we're totally fine. It's like that one cholesterol commercial for cholesterol lowering medicine. It was this really like swanky, you know, silver fox that looked all nice. And he got on the dive board and they're like, you know, it doesn't really matter your cholesterol levels, what you look like on the outside. And he actually does a belly flop. And the commercial was impactful to say, it's not always about what you look like, you know, if you're thin or overweight or whatnot. Same with some of these underlying factors. People can be in a pre-diabetic state for 15 to 20 years. Not everybody is diligent with their health care. Not everybody's getting well person checks. Not everybody's going and, you know, monitoring their blood sugar levels or their glucose levels. And even then, it's based on the medical system evaluating the precursory conditions. They don't always do that. It kind of you have to be broken down for them to give you a diagnosis. But that phase before you break down, you are breaking down. Like if you're a car, you know, the little lights are going on and you're like spewing oil and like puffs of smoke. The medical community doesn't always address that. So that as a naturopathic physician, that's where I come in. Like I look at all of that before we get sometimes to the diagnosis. Some people have the diagnosis, but we can really hone in on resolving some of those symptoms and conditions. So I would say, you know, take they were a healthy person with a grain of salt, because there is an element where it does hit people differently. You're right. And the symptoms can vary. Again, that's their immune system. But then if there is an underlying factor of high blood pressure or heart disease, I mean, honestly, how many people have cardiologists that they see? Like I see one because heart disease runs in my family. That's not how I'm going, and I'm going to monitor that. But most people don't. They usually find a heart doctor when they're having a heart attack in the hospital. That's the first time they see a cardiologist in their lives, and they're in their 50s. So, I just want to put that out there because I really think we have to kind of scale back our assessment of health. And it really does vary. Okay, so I'm going to scoot back a little bit and I want to show you guys, hopefully Instagram, let me know if you can still hear me because I'm kind of far away. So I want to show you a technique and it's called CPC therapy. And it's really a self DIY lung and mucus, like bronchioles and lung related draining. So one of the things that is common with this virus is that people will have pneumonia, and they will have an intense amount of congestion and mucus. There will be mucus built up in the bronchial passages, which are right here, and then in the lungs. And so there's a technique in the back. I can't do that today. I'm going to shoot a specific video that will be a stagnant video, it won't be a live video. But I want to share with you how I do this. And for YouTube, I'm going to take the mic off because it's going to be really loud. So, but you should still be able to hear me. I'm going to put it right here on my desk. Okay. So the thing that you do is you're going to, and I know this because when I was younger, my younger sister had pneumonia, and these were our at-home techniques to break up her lung mucus. It also is stuff that we used when my grandma was in stage and she had pneumonia. So these are techniques that would be used in the hospital. And actually Instagram's going off. So Instagram, I'm going to turn this off so that way I can come back on and we will do this. Okay. So all of you stay tuned on Instagram. I'm going to end on. Okay. Let's see here. Hold on. Let me end this. Let's see. Let me say, I didn't say that. Oops. Okay. All right. We're going back live on Instagram. Hi, Instagram. Welcome back. This is part 2 of our live show. This part, I'm going to share with you a technique called CPC. It is a manual lung fluid motivator. It's a really great technique if you're dealing with a lot of congestion or mucus in your lungs and bronchial passages that will help break up and unclog and drain the lungs of excess mucus. So let's get started with this. YouTube, I'm going to put this down. Okay. So what you're going to do is you're going to take your hands, kind of cup them like this. And what you're going to do is you're going to pat. And you can pat up here. And you pat all around the lung. So I'm just doing like here, these are the bronchioles. And it's not uncommon if you're really kind of moving this fluid, this will break it up. So, our lungs they're a good size. So lung tissue is going to be about that big. There will be space. There's space in between the lungs and your ribs. That gets heavily inflamed. That's where fluid, it actually leaks out from from the vascular channel. So there's fluid that seeps out. And this is what we want to do. We want to break up all of this mucus. This is congestion that will be really, it can be causing low oxygen levels. And this is great for COPD, anybody who has already pre-existing conditions. If you've ever had your breast radiated, your lungs, maybe you had liver cancer, the lungs get radiated in that will compromise the lung tissue. So let me show you again. We'll kind of do another exercise. And I'm going to encourage all of you to do this with me, okay? And you can tell it's very impactful. The other thing to note as you're doing this, especially in this space for the bronchioles, like women, you'll be kind of patting your breast as well. You just be cognizant of the areas that are sensitive. But right here is your thymus gland. And that I've highlighted before, that motivates it motivates and invigorates our immune cells. So this also has an instantaneous immune response. It also will energize your body. So that will be very, very helpful. So let's do this exercise again. Okay, so you cup your hands like this. We're gonna start up here. And you literally, like, it's kind of a boulder impact where you're really cupping your hands and patting the sides. And you can even do like over here on the side. And don't be shocked if you get coughing for, we'll do the side. Let's do the side and then I'll tell you what will happen. And then end with thymus thumping, and thymus bump or thymus tapping. So you kind of go like this. Okay, so after the thymus tap, it's not uncommon to have a little vibration going on, totally normal. So one of the things that will happen with folks who have pneumonia, they will cough stuff up, and the phlegm of the lungs is like this darkish brown red color. It's gross, but that is the mucus color. We are going to, if you do have pneumonia, you're at home, you're recovering, you're going to be coughing that up. That is what we want. That gets that stuff broken up and out. Now, many of you know one of my video sponsors about, gosh, it's almost a year ago, they sent us a massage chair. So I did a review of this massage chair. We still have it. We're in it all the time. If you have a massage chair, there's also tapping on the massage chair. So, some people may or may not have that. There are portable ones that you can get. But why I mention that is a lot of hospital beds actually have these built-in like tapping vibration elements these ICU beds are built, and they will just do that therapy for the patient in that setting. So that is something, just an FYI, if you do have access to that. The video I'm going to film for YouTube is going to be where I'm demonstrating on Brian, and then vice versa. So, that is what you can do on the back, but you can also address the front. So like the bronchioles, that's really good. Kim, does this work if you have a little extra padding? Yes, it totally does. It absolutely does. And in fact, the sides for sure, you definitely want to do the sides. And then the back is very powerful. Daisy, come in. You guys want to see our little puppy dog? Say hi, puppy. Oh, she's my sweet girl. This is the crazy girl who jumped the fence yesterday. She went to visit, apparently, the golden retriever. You want to say hi to everybody? You want to say hi? Oh, it's a good girl. So, those are really the two items I wanted to go over today. I hope this was helpful. Let me know, comment down below if you've been doing if you tried that out. But it's really, really, really powerful. So YouTube, the comments, looks like the comments are stuck. Megan was used when I was a child in the hospital many times with asthma and lung infections. Yeah. So that, like, my sister had pneumonia in, it was 1980. I want to say 85, 86, but very powerful. And I remember getting very upset because I was like, you're hurting her. My mom really go to town, but it really does work. And it does feel good because when that congestion gets broken up, it really moves things. And it's going to move stuff up, but the breaking up is what is going to help minimize some of the inflammation. Congestion, the mucus that really plagues people. What is the name of the thing you tap on? Oh, it's called the thymus gland. So the thymus gland is situated right here. Actually, Carrie, I have a video on YouTube that I posted about it, last week. And it is a stress reducer. So it relieves stress and it energizes the body. It's very, very powerful. Sorry, YouTube, the comment box is stuck on the live chat box is stuck. So So, but that is really, really helpful. And I know that even if you don't have pneumonia or anything, and even if you don't have the symptoms per se, if you feel like you tend to be the one who a cold moves into bronchitis, this is really good to do to clear out and help drain the lungs so that in the event, if you did get exposed, your lungs are in a healthier state. And so, I think any way we can be preemptive is empowering. And that's really what this CPC therapy is about. It's really breaking up the mucus and clearing that out. Because if you already have mucus and inflammation due to, maybe a disease like, the COPD or asthma, or just you tend to be inflamed, or even there's scar tissue. Folks who have chronic bronchitis can have scarring, and then the scar tissue, it plays a role. Well, you can break that up, and you can, if you clear that out, the impact is less. So you really lower that impact. So those are the two things I wanted to make sure you guys knew. What in the event, what are the symptoms? So the difference between the virus here, so the symptoms, the existing virus, and then our common cold, flu, and allergies. It's huge. Megan, you're totally welcome. Okay, so this easy you can do on each other. So for many of us who are quarantining with our friends and family, I'll also post, two other things like just lung wise. You want to make sure you've got your saline. So you're doing saline sprays up the nose. You want to make sure you're using salt therapy for the sinuses. And then the other, and actually I got another one because they have a different, they have two different versions, but use a Himalayan pink salt inhaler. The one I grabbed a few weeks ago has lavender, so it's got a little purple label. And then this one it's a mint, a natural mint. And literally there is it's a Himalayan salt, saline water coupled up with menthol. And that lavender has lavender oil. It has eucalyptus, borneol, and you breathe in and it is clearing. Has anybody, YouTube's comments, I'm sorry, you guys, it's stuck, but I hope you're still seeing me. I've had a lot of people who've commented that they purchased this and they love this. So the lavender is really good. Lavender is an antibacterial. It's an antiseptic as well. Oh, good. So you guys are getting digital thermometers. Yay. Yeah. So make sure you have those. But yeah, do check out these. I'll put links on the YouTube video. And yeah, so I hope this is helpful. Tune in. There's a video coming out later today on YouTube for my lymphatic patients and folks with lymphedema or any type of edema, swelling, fluid retention. So look for that. And then, it looks like the sun's out. So weird here. So hopefully we'll be outside, but if we're not, I'm gonna probably be shooting and stuff and decorating. We're gonna decorate that little bunny today. And again, friends, I'd love for you to send us your letters. So Pat sent us this letter, our first letter. Thank you, Pat. We're gonna be putting these on this back shelf right there. So Instagram, DM me and I'll send you our address. But Gabriel and I had such a fun time opening this up and we're so grateful. And we're going to be sending you all cards back. So just make sure you send us your little address label. And I hope you guys tune in tomorrow at 9 a.m. where I will see you bright and early for more news, more helpful tips and resources to keep you healthy and well. So I appreciate your time and I will see you guys later. Okay, so YouTube, I don't know what's going on. The comments are stuck. Hopefully you guys are all seeing this and I'll reread at the end, but I am so grateful for your time. Please give this a thumbs up if you like this video and share. What I'm going to try and do is start to edit some of these videos. So I pulled the core pieces out and they become their own videos on YouTube, just to circumvent some of this censorship. It's really annoying. I'm seeing our revenues decrease because anyway, everybody, I'm so grateful. I hope you guys have a wonderful Sunday and I will see you again.